Welcome to the Patient Educators Update, where we talk about patient education in a clinical environment. My name is Chuck Jones, and as always, I'm joined today by our guest, Fran London. Hi, Fran.
Hi, Chuck.
Fran is the Patient Education Specialist at Phoenix Children's Medical Center in Phoenix, Arizona. And she's also the author of the book, No Time to Teach, as well as numerous other articles and even another book before that. And it's important to note that the book, No Time to Teach, was the 2010 Book of the Year voted by the American Journal of Nursing, right?
Right.
Okay, cool. It's a great book. I have a copy right here. I always use it for my notes before we get started.
Thank you.
And our topic today comes from page 99 in your book, and it's about teaching with video. The other topic that you addressed in the book was how to set up the video. A lot of people may say, well, you set up means bring in a VCR, right? No, that's not what we're talking about. We're talking about how you position the patient and get them ready to learn. So
Exactly.
What are some of your tips there?
Well, the first thing is to let them know why you're giving them video to look at and what you expect them to get out of it. And it helps to, certainly have seen the video yourself first.
Yes.
And point out before the video starts specifics like, and make sure you look for blank, or make sure you pay attention to this. We're going to be talking about it later. So that helps them pay attention to what's important to begin with. Otherwise, they might be noticing the color of the nail polish of the person in there, and not what you're trying to convey. And then after the video, have that conversation. Have them teach back to you the key points. Have them ask questions. You know, what it is they weren't so clear about. What could the video have done better? And have the processing, the conversation that we talked about earlier with the patient about so what did you learn? And what are we going to do with this information?
Yeah, absolutely. And that's really important, especially when the question you just mentioned about, what did the video not do, or what could it have done? That's valuable feedback, because that helps you fine-tune your library over time, because it's going to change. And the more feedback you get from patients that are, other than, did you watch the video? Yes. Did you like it? Yes. That's not helpful at all.
Not at all.
Yeah. So asking those open-ended questions, using teach back, and one other setup that we always recommend, and you do in your book too, and that's provide pen and paper.
Oh, yeah.
So that they don't have to write down big questions, but if they can just write down keywords or questions that didn't make any sense to them, or something that they didn't think was right, that really helps with the conversation, because one of the things the nurse can do is say, well, let me see your notes, or what questions did you write down? And
I don't know about you, but I always forget stuff. So if I was watching the video, I know if I don't take a note, it'll be gone by the time the nurse gets back in for the conversation.
Yeah, there's no doubt about that. And the older we get, which is what is the case with a lot of patients in hospitals, the less that memory works the way we want it to. So pen and paper is very nice. And the other thing with the follow-up, one of the things, if the nurse educator is using assessment and teach back the way you teach it, they will quickly know if there was learning accomplished from the video based on the questions, and then they can politely ask the patient to watch again and look for, something else. Because, I know you've been to a movie, and after the movie you said, that was a really good movie. I want to watch it again to see what I missed.
Yeah.
Yeah, same thing applies here. And so the nurse can quickly understand if the patient got the information they were supposed to, and if they didn't, make sure they watch it again. Maybe if a family member is not there, make sure that leave a note for the family member to watch the video. And that can help with that incremental learning that you talk about, where education starts from the day you're admitted as opposed to on discharge.
And when you see a video for the first time, you might notice different things than you would later on, because you
Yes.
have more knowledge later on. You're noticing things that you would not have otherwise noticed.
Yeah, absolutely. Yeah. And so you have some great tips in the book on what to do with video. And, it was a short topic, but I know when you wrote the book some years ago, video was not nearly as prevalent back then as it is today. We didn't have online video to the extent we were doing other things. So things have changed a bit.
A lot. And people are used to watching videos to learn stuff.
Yeah.
I mean, just searching YouTube is the second biggest search engine, I think, now.
Yes, it is.
People want to learn how to do stuff. They want to see a video on it.
Yep, absolutely. Yeah. Now, let's see. Do I have any more questions for you? I know this is something that we talked a little bit about prior to the show. One of the things that videos can do, we talked about layering information for incremental learning. We talked about watching multiple times, family caregivers. Can you, we didn't address this specific question, but can you talk about educational barriers and multiple learning styles and how video can help in those?
Well, again, since a lot of people learn by watching TV, especially people who can't read, they look at video, they see people doing things. Visual learners or people who can't read do much better with having that offered to them, because then they're not intimidated and they feel like they're being listened to and taken care of. So it certainly is important for that population.
Yeah. I know one that we recommend that a lot of hospitals do, especially those that do a lot of repetitive surgeries, is have the surgeon or the surgeon's assistant or somebody who can be reasonably good on camera do a post-surgical video for the patient that goes through all of the steps that the doctor wants them to do regarding everything from wound care or exercise or medications or whatever. And the reason we recommend that is because those are the types of repetitive things that any surgeon, any person, when you do the first one for that day, you're going to remember everything. But if you do 10 that day, you're going to start leaving stuff out.
So it would aid to have that on video. Yeah.
And so the thing that doctors can do is record the video, and then the patient has watched it, they have questions, and then instead of going through this laundry list of things you want to do, and then you say, you have any questions? The patient says no, because they just want to get out of that situation. They can say, well, yeah, I watched your video and I don't think I can do this or whatever. And so the consistency is there, and then the opportunity for engagement and questions is there as well.
And it's variety too. I mean, variety helps people pay attention. If it's all the same lecture, it's not as interesting. Yeah.
And one of the things that's happened, and there are studies that support this, in the beginning, everybody wanted polished, professional video. I mean, that's what you had to have even 5 years ago. But some studies have been done, and the people that watch the videos go, well, no, I don't necessarily care if it's super polished. I just want to be able to hear it and understand it and watch the pictures, and that they be relevant. And so one of the key things that we tell people who are going to make their own videos is make sure you have a good microphone and good audio, because that would kill the video quicker than anything. And you don't have to worry about having fancy lights and fancy actors and all this stuff. You can actually do these videos with a good phone camera, and they can be good. They can be relevant. And I'll tell you a quick example. All I'm going to do is make this video longer. When my wife had shoulder surgery for frozen shoulder syndrome, and the physical therapist came in to give her a list of exercises, and she had the Xerox sheet that had been Xeroxed a million times, and some of the words you couldn't quite make out, and she said, you do this, and my wife was just kind of looking at that, and I said, do you mind if I videotape you while you demonstrate these? And she said, well, no, that's fine. I just pulled my phone out and videotaped the entire instructions that she gave. And then when we got home, I put that on the computer so my wife could, when she forgot what to do, she would go sit down and look at them. It's like, oh, now I remember what to do. She could have never gotten that off that piece of paper.
Right.
And so it was, and that was not professionally done. We didn't have great lights. It was just my phone listen to the physical therapist give her instructions, and it worked great for her.
Well, I
So
think your point is that, I mean, back when video first started, we had TV to compare it to and
yes,
movies to compare it to. Now we have YouTube to compare it to. So people's expectations are different.
exactly. You were dead right on with that. They certainly are. Now, given that I've
I
been
have a
doing,
question for you.
yeah, sure.
What about the different kinds of video systems? I've never seen a good explanation of like what your options are and
Oh, sure. Yeah, well, if we take it to the basic stuff, you will find that there are manual type systems where they have a DVD that they can play. Some hospitals actually still have a TV on a cart with a VCR and a DVD player, and they roll that from room to room. There is video on demand over the cable system, which is one of the things that we do. There's video on demand over the hospital's network, and there's also online delivery. And you can also get things downloaded on iTunes and things like that. You can watch it on your phone. And back in the day when we first started doing this, we did videotape robots, but now everything is digital. And one of the problems with some of the early stuff like DVDs and carts is that you lose track of where they are. And then the nurse winds up spending an inordinate amount of time tracking that stuff down. Things get broken, things get stolen, things get lost, and that's a problem. Online video is great if the patient has access to a computer after they leave the hospital. To us, hospitals have a great in-house solution, and it's called the in-room television set. It's there, and many times the patients have not a whole lot to do but lay there and watch TV. And so it can become a great tool by putting some education on there. And that can either be done with a channel that runs specific videos on a schedule or a video on demand system. And the advantage of video on demand is, remember your teachable moment. With video on demand, the patient can watch whatever they need to watch when they want to watch it. So when the nurse is in there talking to them and the patient might ask a question or something that she can sense that teachable moment, then she can say, hey, let's watch video number so-and-so. Get your pen and paper, take a look for this, and I'll be back in a few minutes and we'll talk about it. That's the perfect use of it because video becomes the tool and it helps the nurse do a better job of facilitating and teaching because now he or she can teach based upon real questions that the patient picked up from the video. And so that's a big advantage. And the fact that the system is available 24/7 when you have patients that can't sleep at night, they can be watching things and they can learn. And so it's a great opportunity for hospitals to take advantage of a system that's already there that they don't have to spend any more money on. It's a small addition, less than a full-time employee in many cases, and that's for a year where this system will last a lot longer than that and requires very little administration. So it's a good opportunity for hospitals to utilize existing infrastructure and then support the nurses in an important way by giving them extra tools.
so it's the most efficient to use, the most appropriate for the teaching experience, and probably saves money.
Yeah, there's no doubt it does over time, no doubt.
Cool.
Yeah. And one of the things that is big right now, and you and I have talked about this, and that's documentation.
Ah, yes.
That's a big. As a matter of fact, we got a letter from our insurance company the other day, and they talked about all these things that they have to do for education with us as as employers, and we pay money for it, and then they whatever coverage we get, and they talk about the documentation of education. Well, if you have a video on demand system similar to the ones that we actually have an HL7 interface, and so we can take orders from the doctor through the ADT system and the patient record system, and then when the patient watches something, we can post that to their record, and then even have a summary at the end of their stay so that everything is documented, which is and no one has to do anything. It system does it on its own. based on input from the doctors. In other words, patient is to watch a certain video. Let's say we have a customer in California that does a lot of heart surgeries, and they have some very specific videos that all the patients must watch prior to the surgery, and then some after the fact. Well, we can document all that stuff for them, and they don't have to do anything special. So it saves a lot of time that way, so that nurses who don't have time to teach now have more time to teach.
They don't have to document that the video is seen. They can document the evaluation of understanding.
Exactly, and that's where their effort should be. That's the most important use of their time, I think, anyway.
I do too. Absolutely.
Yeah. Anything else that we need to cover on this? We've kind of gone a little longer than normal, but this topic gets me revved up.
I'm sure we could go on and on, but I think we covered the most important points.
Okay. All right. Cool. Well, I'll tell you what. We'll put some additional links and information in the show notes, and then I'll put my how to flip patient education video e-paper in there, and it's free. And so there'll be some more stuff for the folks to take a look at if they want to. So before I let you go, why don't you tell folks how they can find you online?
Okay, well, I'm on Twitter at No Time to Teach, and I have a website, www.notimetoteach.com, where I blog about patient education stuff.
Yeah, you do, and you do an excellent job of it, I might add. I want to point out that your book, No Time to Teach, put it right there, is available wherever books are sold. It's in paperback and ebook form. And I would encourage people to take a look at it. It's a small book, but it's packed full of very useful information. And for hospitals, you directors of nursing out there, if you want to make a bulk purchase of this, you can go to the publisher, Pritchett & Hull, and that's p-h.com, and you get a sizable discount if you buy copies of 30 or 40 books. I'm not sure I can't remember the number, but it's an excellent discount for bulk purchase. And that's a good way to use this. And that way you can get your entire staff on a consistent and proven patient education process. And if anybody's interested in learning more about video-on-demand patient education, you can visit our website, synergybroadcast.com, and look for our patient education system. We call it MMDS, or Medical Media Delivery System. And we'd be happy to entertain any questions anybody have. So, Fran, I really appreciate your time today. It was good to catch up again. I look forward to talking to you next week.
Okay. Thanks a lot.
You bet. Take care.
Bye.